Hi, welcome. My name is San, and my goal is to bring useful information to you so you can have the best health outcomes possible. So let's get started.
Okay, now we're going to talk about oncology emergencies. What does that mean? That means when there is a particular issue that could require immediate attention, and if not, then it could cause significant harm. So that's what we want to talk about. Why do we want to talk about it? That's because we know when you're going through your cancer treatment, you're going to have a dozen or more side effects happening at the same time, right? And with the treatment, with these side effects, sometimes, despite our best efforts, things can go wrong and something just doesn't feel right. Most people do have 2 to 3 complications while going through their treatment. So we want to be aware of what are the possible things and be able to catch it quickly so that we can catch it when it's just getting started and we can address it so you can have, you can get the right help and you can have the best outcomes possible. And of course, we want to try and prevent as many things from occurring, because we want to try and prevent as many issues from occurring by learning and educating ourselves through the different modules and courses that you've been doing with us. So good job there. These are things that still might happen. So we want to know, we want to be aware of them if something like this happens and get the help immediately. All right, so now when we go into oncology emergencies, essentially I'll be covering with you quite a few of the conditions. So I don't want you to get nervous about it. It's not like it happens to everybody. It's not like these are the things that happen all the time. So don't let that deter you. Know that these are once in a while things, and you're educating yourself so that you can be prepared for what's coming. It's a broader overall concept. What I would say is that, look, if you are having fever, if you're having infection, you're having fever, or you're having bleeding from any part of the body, or you're not able to do the basic physiological things that we do, that's breathing and eating, drinking, any of those regular things, or if you're losing your consciousness, or something just feels really off, then it's best to go get it checked out. It's better to err on the side of checking more than checking less when we are going through our cancer treatments. Okay, so with that overview in mind, let me walk you through the different potential emergencies and what you can do about it. How do you can detect it? Oncology emergencies, when there is a medical condition that needs immediate attention for our health and well-being. Now, what can you do when there is an oncology emergency? In those cases, before the emergency happens, most of the time you want to have a plan. We work with you to develop your plan, know what are the options, what you can do, have things ready. So you want to do that for yourself, have a plan, know what your center provides in terms of resources, or where you can go. Is there a doctor or a clinical team that you can call? So you want to get all that information beforehand. You want to know who is the person who can help you in those scenarios. So now, in terms of the different types of emergencies, there are quite a few. I'm going to go through some of the most common ones, and I'll help you to see a pattern in that.
Thank you for watching. If you would like to know about more content along these lines, then hit the subscribe button and the notification bell so you'll be informed when we create more. If you like this video or you have some thoughts to share, then please comment and hit the like button. And you can always reach us on our platform and the different sites which I've put in the description below. Thank you, and my best wishes to you on your healthcare journey.